This is another edition of Mornings with Blatchford. I'm Dr. Christina Blatchford.
And I'm Dr. Bill Blatchford. This morning we would like to talk to you about what I consider to be a staff-initiated bonus plan. You know, we're all very trusting. We think everybody else is honest and all that sort of thing, and they are. I want you to understand, we're talking about the minority here. But it does happen, and every year in our program, and we have a very small sample of a couple hundred doctors, but it happens every year, a staff-initiated bonus plan. And the reason, doctors, is you make it easy. You don't pay attention. I'm taking care of the teeth, I'm in the back, the people in the front take care of the money. You don't even look once a month at your accounts receivable and that sort of thing. So please, let's pay attention to this. Now, remember also that when a team member, an individual team member, is taking money, it affects the whole team. So team members, if you see something suspicious, look into it. Stina, could you tell us a little bit about some specific things that doctors should do to prevent this sort of thing?
Yes, good question. So, number one, let's have a checks and balances system in the office. For example, do not have the person at the front be responsible for all incoming money, doing the bookkeeping, and also doing the payroll. And you might think that's
and the deposit.
Yeah, you might think that that's kind of extreme, but I will tell you, I actually had that happen in my office when I first took over, that there was a very much of a power position up front. Be careful about that.
Yeah, and another thing too, a sign you watch for is when you have somebody who deals with the money that wants no one else to know what they're doing, hesitant to train anybody else on the computer. This is my domain, I want no one else up here. Huge red flag. Another thing to watch for is what's going on and watch your cash income. You know, a few years ago, we had a doctor who had this happen, and it cost him in 7 figures before it was done. And by the way, the lady is now serving time, which is the right thing to do. In other words, prosecute. But unless you have absolute proof, most DAs won't even touch it. In this case, this receptionist was telling people on the phone, if you bring cash for this procedure, it's this fee. If you pay by credit card or check, it's a much higher fee. And so most people brought in the cash. I'm talking greenbacks. Now, the doctor never saw them, but it was a very simple thing. It was actually a whitening procedure, and so that patient was simply, the record of their visit was taken off the computer. Now, the proof was the audit trail on the computer she was not aware of, and it showed exactly who deleted that patient's record along with the amount. That put her in jail.
Yes, and so what you want to do, 2 things. Number one, we want to see a day sheet of what money each patient owes us for the procedures that we're doing for that day. We want to see that at the beginning of the day. We want to see that at the end of the day so that we really can follow this. And one of the things that we suggest for doctors who may not have paid any attention to the front desk and how that all works and are just going along and doing the dentistry like you said, is pretend like you know something up there. Just go up and check these numbers. Make sure you're checking with your receptionist the accounts receivable at least twice a month.
And my suggestion is invite your CPA to come into your office from time to time, maybe once or twice a year, actually physically present in your office and go over some guidelines with you to avoid this kind of problems. It's real simple to do, and I can tell you, when it happens, it is devastating. It's not just devastating financially, but the emotional
trust. You lose the trust
that you have been violated is huge, and it takes doctors sometimes. I've seen it take several years to get over it. I literally have people coming to us in summits. This happened 5 years ago, and they're still talking about it. So it hurts. So doctors, you can tweet us at Dr. Blatchford.